This is Inside Urology, Cutting to the Chase, a podcast from the Indiana University School of Medicine Department of Urology. We talk about all things urology with Dr. Clint Carey. Each episode features conversations with physicians, researchers, patients, and we'll share some of the stories shaping the field. So let's cut right to the chase. Welcome into Inside Urology, Cutting to the Chase, Episode 4. I'm your host, Annie, and I'm here with Chair Dr. Clint Carey. I realized the last episode I didn't even introduce us, so that's great.
Nice.
Just talking heads, I guess. So again, Annie, Dr. Clint Carey, the chair of our department, and we have a very special guest today. We're going to cut right to the chase and get to her. Her name is Amy Tennant, and she's a registered nurse. Hi, Amy.
Hello. Thank you for having me.
Thanks for being here.
Yeah, thank you for being here. You have a very unique role, and I'm going to hand it over to Dr. Carey to kind of explain how unique and just specifically about the testicular cancer nurse navigator role that you're in right now.
Amy has a very special role, the first testicular cancer nurse navigator that IU Health, IU School of Medicine has had that is dedicated to patients that come in for one of the surgeries that we're known for testicular cancer, retroperitoneal lymph node dissection. And so Amy and I work very closely together to help manage patients' care and getting them here. And she also works with Dr. Tim Masterson as well closely.
Just for those of us that have no clue, what is a nurse navigator? What do you do?
So as a nurse navigator, I serve as the primary point of contact for testicular patients and their families. That includes being an advocate for patients. The role is really about guiding patients through medical, emotional, logistical complexities of their diagnosis and treatment plans. So navigation often acts as a liaison between patients and the multidisciplinary team to make sure that their care journey is seamless and stays patient-focused. One of the biggest things in navigation is removing barriers to care to ensure patients are being seen.
So I guess, when are you brought in? Like, at what point do patients start talking to you, or do you start to talk to patients? What timing is that like?
So that starts at the very beginning, at the time of the referral. So oftentimes I'm getting the referral, reaching out to the patient, letting them know we have it. You know, they're in our queue. We're working on getting their records over, and we get them set up for their initial consultation. So I've already done essentially an intake before they've even been seen.
I think, and I think we should also mention, I mean, this role is unique in that probably 70 or 80% of the patients that we're dealing with are not from the state of Indiana. Many may or may not know that IU is a large national, if not international, referral center for testicular cancer. And so I think that's a unique role to Amy's job, is navigating not just the diagnosis and helping them get in to see us and like clinic appointments and help with surgery scheduling, but also just navigating that part of flying halfway across the country and never perhaps have even been to the state, and making them feel comfortable in that process.
Which is a really special thing, somebody coming from out of state, they don't know where they're going. They have this scary diagnosis, this scary thing, all these people they have to talk to. Just kind of walk through maybe the first appointment or the first time you see them. What's kind of your, opening line to them?
Welcome to Indiana. Go Hoosiers.
That's a good one. I mean, yeah, it's great.
Welcome to Indiana basketball.
I usually say welcome to Indiana, under the circumstances, of course.
Right.
It used to be a classic movie line, welcome to Indiana basketball, from the movie Hoosiers, but this year it maybe should be welcome to Indiana football.
That's right.
Yes, it should be.
But we digress.
So how did you get into this? How was this role kind of shaped for you?
Well, I've been in urology since about 2016. I started as a nurse in the Methodist clinic, and then initially supported general urology, and then had an opportunity to work with some of the urologic cancers, which I just really kind of felt my calling to, just making those relationships with the patients and being kind of their go-to person. It just kind of stuck with me. I knew I was going to stick with oncology. So when I heard about that there was this new position that was opening up for a testicular cancer navigator, I didn't know a whole lot about testicular cancer at the time, but just knowing, the rich history of the testis cancer treatment and how the RPL&D was pioneered here, it was definitely something that sounded appealing to be involved with.
This started as a vision of mine when I was trying to elevate experiences for patients. I was actually going through my MBA program, and I can't remember if it was marketing or operations class or whatever, but I had to do a project, and this seemed logical given my interest in testicular cancer, and it became immediately apparent, like, we did not do anything, despite our national and international prominence in the disease, and we had patients coming to us for surgery and chemotherapy in collaboration with medical oncology. We did those things at an extremely high level, but we did not really elevate the experience of the patients, knowing that they were coming from all around the country. It was almost as if I felt they were being treated as they just lived down the street, and this was very normal for them to travel these long distances. So, and I'll have to say that I did have to, obviously the system has to support that and help with, supporting Amy's role. And I had to talk to various people within IU Health to get their support. And I'll have to, now that we're 2.5 years into this experience, this has just been an incredible thing for patients. And so I'm very appreciative to Liz Linden, who is our COO, that I had several meetings with about this, and she was and is very supportive of this. Fortunately, and as Amy had mentioned, we had knowledge of her in the past. She had worked in our department before, and then we made sure that she was aware of the posting. And besides the interview that we did with her, I'm curious to understand your recollection of how that process went.
I was hoping you weren't going to ask me that. I just remember coming in for the interview, and Dr. Carey obviously had his vision, and you could see that he was just so excited and passionate about the testis cancer patients in the program, and that really kind of got me excited about it too. But I just wanted to make sure that I was the right fit, so we had a few subsequent conversations just by phone, just to make sure that it would be a good fit, and ultimately, it was.
Why don't you share what your initial answer was to the job offer?
It was, thank you for the opportunity to interview. Best of luck.
You said no.
Yes.
I said no.
She turned us down, and, we had interviewed, people for this role, and Tim Masterson and I talked after, going through these interviews, and I may have told him that obviously you were the best candidate we had, and that you had said no.
Hopefully not the only candidate.
No, definitely not the only candidate. You were definitely the best candidate, and we both recognized that. And when I told him that you had turned the offer down, Tim's immediate response to his credit was, it doesn't matter. We still got to get her. And and obviously I immediately agreed. And I do remember, I don't know if we scheduled a call or maybe we just bombarded you with a out of the blue call. I think I called you, and then I three-way conferenced in Dr. Masterson, and we basically just put the heat on you until you couldn't say no.
Yeah, the heat is on.
So you said yes. So here you are. So when you first started, what did the role look like?
So I was lucky enough to walk into the role at the time it was created. So there was no one in the role before me. Dr. Carey had a nice framework laid out of kind of what he was looking for and, what he was hoping for and envisioned for the position. I was given the luxury of a little bit of time to observe, different parts of the hospital, spend time with the surgeons, go to surgery, spend time in clinics with different nurse practitioners, providers, the administrative assistants, and then other oncology navigators within the hospital, social work. So really just kind of an all-encompassing sort of orientation that I think really helped us look kind of like at the global picture of, how we wanted to build this position.
I think the thing that I was impressed with when Amy first started was that there was no previous role, and so it really was a blank slate. And she really took a lot of time to try to understand kind of what the patient's journey was. And even coming in, she came and observed some surgeries, even inside the operating room, rather than just coming in and going to work. She really took the time to try to understand all the various aspects, how patients could interact with several departments: radiology, labs, medical oncology, hotels, places to stay. I think that was I was really impressed by that effort, rather than just jumping in and kind of doing the standard things and calling patients. She really took the time to try to understand what they would be going through, and that has allowed her to build this program to what it is.
Were there any gaps that you saw immediately that you were like, oh, this would be great for me to help out with, or I see this here that could really use some help?
I don't think there was anything majorly glaring. I mean, the program was already up and running, but to have a dedicated person to Tessa's cancer, who's kind of walking in, that's my sole purpose of being here. I think we were just able really to give the time and kind of fine tune some things to help the patient experience.
And we talked about this a little bit, but the difference between patients coming from out of state or people in state. What's the difference? How do you kind of handle those patients?
Yeah, so it's honestly like a rarity to have patients from Indiana, especially patients coming for RPL&D from Indiana. But we do have them. I'm just so used to having the out-of-state or the international patients coming in. Typically, what we'll do is they'll have an initial virtual consultation with Dr. Carey, Dr. Masterson, and then we kind of follow them from there, schedule their preoperative appointment the day before a potential surgery. We help with all the logistics of getting them here, and then once they're here, I go to their pre-op appointments. I orient them to the hospital, take them to radiology, take them to lab, personally accompany them so that they don't feel lost, and that they feel as comfortable going into the surgery the next day as possible.
How helpful is that for them?
I think pretty helpful. They say it is. So it has definitely reduced a lot of anxiety for people. I mean, you're traveling across the United States. Some people, we have people from all over California, all East Coast, West Coast. I think we've hit just about all the states. So Puerto Rico. So I think it is really helpful for them to have a go-to person, someone that they've spoken with on the phone multiple times before even coming to Indiana. And then it's always like a little bit of a celebration when we meet each other in person. Lots of hugs, and it's just so nice to put the face with the name, and I feel the same way, meeting them.
I think one of the very concrete example of the value is, patients may get updated CTs before they come to see us, and obviously they're anxious. Did anything change? Is this going to change surgery? And so they'll reach out, and there's been examples where, they get the CT scan. It gets Amy helps get it uploaded into our cloud system, and we're talking to them about the results of the scan 4 hours after they had it back in whatever state they're from. That really wouldn't have happened without Amy here and her dedication to even helping get the cloud system set up or make it more seamless for us to be able to do that. So that's a real value add for patients. Helps with their anxiety. Helps with knowing that they've got a team looking out for them, and I think that's super important.
I'm sure you get questions of all sizes, from really small things that, is making someone anxious, or really big things. What's maybe the most common question that you get? Or
Most common question is probably, where are they going to stay when they get here the day before? The logistics of the hotels and things tends to stress people out. And we do have a lot of resources for patients who might have some financial barriers too. So being able to talk with them about what's available to them, I think is really helpful. One of my favorite questions, and I've actually been asked this probably 3 times in 2.5 years, is, can I bring my PlayStation?
What?
Yes.
Yes.
Really important stuff.
It's very important. Yes, you can.
Yeah, you can actually.
Yeah.
And
Like-
people actually have brought their monitors too. They have the whole video game set up. Got a game.
Anything else? Any other questions that you're like, oh, I didn't think about that, not being in that situation?
Yeah, I think we do a pretty good job. Like, one of the things I've really tried to focus on is, when I first came, we had a couple handouts that we might give the patients, after the consultation. And now we have a 32-page comprehensive surgical packet that they receive before they get here, so that they have time to review it. And it includes, common questions about the surgery. So we're talking, length of surgery, how many days will I be in the hospital? What are reasons for me to call after surgery? And then they've got dietary recommendations for after surgery. They have exercise program that they can start 3 to 4 weeks after surgery. There's also information about the hospital, about the lodging, kind of this more just nuts and bolts of, how to get here and how to get around. So I feel like they're pretty well prepared once they get here. I also call them a few days before their travel, just any last minute concerns. Is there anything I can help you with? And then once they're here, they're pretty much ready to go.
So it really is before care, during care, and then after care.
Yes,
You're not just
absolutely.
kind of thrown back, on a plane or wherever you're going to go back home, and
Nope.
then crickets, you don't hear from anybody.
I think that's what patients want to know, is that we're with them through the entire journey and that they have us in their back pocket. So it's very common for patients to go back home, have some anxiety about that first set of scans, contact me and say, I'm really nervous. Can you look at these? And, we'll get the scans over, the records, Dr. Carey or Dr. Masterson take a look, and just giving them that reassurance that, yes, everything's good. You don't have to fly back here to do that. We can just do that over the phone.
And I imagine it's really like a family involvement. You're not just dealing with or working with the patient. Their family may be coming with them and they may have questions. And talk about that a little bit.
Yeah, so with the testis cancer population being, young men, generally teens, 20s, 30s, 40s, we have a lot of young patients, single guys who come with their parents. We have young families who are leaving little kids behind at home, which causes another level of anxiety for people. So just trying to support the family members probably just as much as the patient themselves. I always have a little bit of time alone with the families when the patients go back to get their blood work. So, we just kind of spend some time just chatting and trying to make them feel more comfortable and answer any questions they have lingering.
Okay, so we've talked about how you turned us down and then we made you come on board. We talked about how you kind of started the program from scratch and really, I know I gave you some guidance on things, but it was built along your vision as well about how you wanted to do this. And we've built this into what it has become. With that, what do you think you're most proud of about this?
I first of all, I'm just proud to be on this team. We have such a great team, and everyone is so supportive. And I'm really proud of, despite the fact of advanced technology, large institutions, that we have been able to personalize and make meaningful experiences for people, and that we have really just shown them the Hoosier hospitality.
Yeah. I can certainly tell a difference. I'm sure Tim and I both have stories about the praise you get from patients that they tell us that you don't hear. and we share some of those probably, but probably not enough. And so I definitely think this is made our program more complete. I mean, we had all the services that patients needed, but this has definitely kind of put a bow on it, I think. So I'm definitely I'm proud that the system has supported it. I'm proud of the work you've done, and I don't think that it could be a better position that you've created and what you've done. So I'm very grateful about that.
Do you see this role evolving in any way, changing?
I see it definitely evolving as we get kind of more comfortable and better at certain areas in the navigation role of, trying to do some additional work, especially in the area of survivorship. The patients are with us for kind of a short period of time, and then, we kind of slowly release them back to their home oncologist or urologist, but just finding a way to just make sure they feel supported long term. I think that is one of the big things I want to work on, as well as developing a peer support network for them. So often, a pre-op patient may be talking to a post-op patient just to kind of talk about what was it like, I mean, there are patients who find testicular cancer support programs elsewhere, but I think it would be really nice as a leader in testis cancer for us to kind of hone in on something that is our own.
You're mentioning some of the things you hear from patients maybe later on, like, oh my gosh, you really helped me with XYZ. Do you have anything that's really stuck with you, or any specific patient or moment or anything that you really think about? And
I actually brought a whole list with me right here.
Oh, we have time. So,
but one patient in particular who lives near in another state, near another high volume center for RPL&D and testicular cancer, sought out some additional opinions, his local opinion, and then came here and ultimately expressed to me that he came to our institution because of the quick response, accessibility, how friendly we are, just felt a lot more comfortable in being able to reach us, knowing that after surgery, if he had concerns, there was a direct contact in. You don't have to leave a message somewhere in a random voicemail. You're going to get straight to that person. So that was really nice to hear. I was pretty proud of that moment.
Yeah, that's awesome. That's in essence, that's what that was the point of the role, to make, the care was being provided in the hospital. It's everything else. It's the before, during, for family members, after. That was really the vision for this, is to make people feel comfortable while they're here.
best advice that you give patients?
Okay, so the best advice, I think it's just honestly reassuring them that we are with them every step of the way. Even when they leave Indiana and they're back home with their local doctors, we're here. So they're not alone. We're going to be walking right there with them. If they have a concern, they know they can reach out.
And I'll say Amy's persistent. We're all busy, and sometimes questions come in, and she will. There's multiple ways she can get in touch with us. Sometimes we're in the operating room all day. Sometimes, we don't get to an email right away. She will get her answers back if it's text message, phone call, email, electronic medical record message. She's going to fight for the patient to get the answer they want. So she's persistent in a very good way. And she's advocating for patients all the time.
I'm glad you see it that way.
Do you have any advice for any young nurses maybe looking to get into this type of role, specifically oncology navigation? Any advice for them?
I would say navigation is not about having all the answers yourself. Sometimes you're going to have them, sometimes you're not, but it's being the person who knows who to call to get the answer, and it's the follow through that's going to make the patient's meaningful experience.
Awesome.
Time for the fun stuff?
Yeah, now we get to the
There's
fun
fun stuff?
There's fun stuff.
Yeah, I didn't like that I didn't know what the fun stuff was.
These questions are going to be way harder.
You want to go
Okay,
first?
sure. Okay. Book, movie, show. What are you into?
I have 3 kids, so I don't get to do a lot of things other than chores. But
You should have them doing chores.
I try. Let's see. I really like the movie Dumb and Dumber, the original.
Yes.
It's just ridiculous. I do read.
What's your favorite
time
scene?
to time.
What's your favorite scene in Dumb and Dumber?
Oh gosh, I don't know.
Snowball to the face?
I do like Snowball to the face. There's too many.
All right, so we go Dumb and Dumber.
Yeah.
Any shows, TV shows? Any you care to
see.
admit to?
I don't really. I'm not a big TV watcher. I usually watch whatever the kids are watching while I'm doing something else. But I'm boring.
It's okay.
I do binge watch a Netflix series from time to time. I'm trying to think what the last one was. His and Hers. It was
Oh,
it's
yeah.
pretty raw actually.
He was a cop.
Mhm.
She was a journalist.
Yeah,
And
the ending surprised me. I was not expecting that.
We
Did you
won't
watch
get-
it through?
Yeah, we won't give any spoilers, but
Okay.
I figured it out earlier.
You did.
I did.
Ah.
Yeah.
How about this one? If you weren't doing what you do now, what do you think you'd be doing instead? Firefighting, skydiving.
No. I would probably be retired.
That sounds great.
No, I love doing this, so I love it.
You usually ask this one, but I'll ask this one. What is a completely non-work skill that you're oddly good at?
A skill, okay.
Yeah, you could use that broadly.
Yeah, it could be like a random hobby or something that you like to do outside of work.
Well, I really like snow skiing, but I don't get to do it too often. I'm very crafty. I like to make cards.
Make cards?
Yeah, like
Okay.
homemade cards.
I don't know.
That's
if I've
awesome.
ever- you give me something like for Christmas, and I don't know if I've ever got a homemade card.
We'll have to see.
Yeah,
gotta work on
You know
this.
what? I bet it fell in the package. Like on the side. You might want to check the bag when you get home.
Now we know what you're going to get for Christmas.
Homemade card.
Well, thank you so much for coming on, Amy. You're so important, and we're looking forward to seeing what you do.
Thank you. Thanks for having me.
Thanks for joining us on this episode of Inside Urology. Make sure to follow, subscribe, and share this episode with someone who might like an inside look at the world of urology. And stay tuned as we keep cutting to the chase.